Today I'll be taking a topic of great practical significance, and the importance is not only for those who are fresh, but those who have been doing ultrasound for years will also find this topic to be very beneficial. Now, let us start with a video. Now, if you go to this video, let us see this video. This is a cystic mass we could make out, and it has floating echoes. Can you make out floating echoes which are just moving towards the base? Now, whenever we find a cystic mass with internal echoes, there are various things which come to our mind. Now, one thing is hemorrhagic cyst, other one is endometrioma, and then cystadenoma, dermoid. So these are the common ones which come to our mind. Now, this movement of the particles which is towards the base, in this case you could make out that it's gradually moving, and whenever such movement of the particles is there, what does it tell you? That the fluid is there which is not very thick. There is no clotted blood, because if the blood is clotted it will not move like this, and the particles, if they are very thick, then also they are not going to move like this. Now, endometriosis is a condition in which the particles are thick. So the fact that these particles are moving suggests that endometriosis is a very unlikely possibility. Uncommonly, sometimes when there is active hemorrhage, then in that case some movement may be seen, but in majority of the cases of endometriosis you will not be able to see such a movement. So the fact that these particles are there and they are moving means that endometriosis is practically ruled out. This was a case of cystadenoma, and in cystadenoma we can see movement of the particles. Similarly, you may find such movement of the particles in acute hemorrhagic cyst, but of course in chronic hemorrhagic cyst, when clotting has started, the particle movements will not be seen. Now let us go on to the basic topic, which is acoustic streaming. Now, what is this acoustic streaming? Now, this is movement of the particles within the fluid, and this is caused by the energy of ultrasound beam. So this energy of the ultrasound beam is pushing the particles towards the base. So the movement is away from the transducer. Now, in order to elicit this technique, now it may not be seen in all the cystic masses of cystadenoma or acute hemorrhagic cyst or so, but whenever it is seen, it is helpful. Now, in order to get this movement, what is the best thing we can do? One thing is that we try to get the cyst as closer to the transducer as possible. Why? Because the closer it is to the transducer, the more the energy will be going towards this cystic mass. And this is what we can do. We can try a bimanual technique. Now, when we are doing TVS, we can push with a TV probe the cyst anteriorly towards the anterior abdominal wall, and as a result the cystic mass will be closer to the probe. One more thing you have to do whenever you are trying to look for such particles, try to move the probe subtly so that the motion artifacts are not there. Now, this subtle movement of the probe to avoid motion artifacts is significant when you are using color Doppler. Now, we'll be taking that thing towards the end, and color Doppler is always much better in getting this motion. Why color Doppler is better? Because the energy produced by the color Doppler is much more, and in such a case you can see better such a movement. Although in many cases, even without the color Doppler, you can see such movement. Now, B mode gains, of course, they need to be high so that you can see the particles better. When you see them better, then only you will be able to see the movement better as well. So acoustic streaming, this is helpful in determining the cyst type to a certain extent. Endometriomas do not show acoustic streaming, as I told you, until unless there is an acute hemorrhage when you can see some part of the endometrioma showing streaming. Cystadenomas, they do. Lack of acoustic streaming increases the possibility that the benign mass is possibly an endometrioma. Of course, I've told you dermoids and hemorrhagic cysts can also show acoustic streaming, and hemorrhagic cysts can show when it is an acute hemorrhagic cyst. Now, this part I've already told you that as there is clotting, the acoustic streaming disappears, and you won't be able to see acoustic streaming in clotted blood. You won't be able to see acoustic streaming in chronic hemorrhagic cyst. Let us see this case. In this case, you could make out that there is a fluid level. Now, whenever there is a fluid level, then in that case, suppose such a fluid level is there. There are two common possibilities. One is hemorrhagic cyst and the other one is endometrioma. Now, in both cases, the upper part, which is the lighter one, is likely to have less dense particles, and as a result, there may be some movement. So, fluid level, even in cases of endometriotic cysts, may show movement in the upper part, which is light. Now, just go on to this picture and you could see this is a cystic mass with homogeneous internal echoes. First look, it may suggest that this is endometrioma, but it turned out to be cystadenoma, and in case you can scan and you can appreciate the acoustic streaming, the diagnosis is very clear in that case. Let us see this video, and here you can make out, see this movement, subtle movement, very clear acoustic streaming, and you could see some leveling is also there, but both the cases you could make out that there is movement from top to bottom, and although there is some fluid level type of a thing, but the fact that there is movement suggests possibility of hemorrhagic cyst over endometriotic cyst, because you could see the movement is even towards the base. Now, this is what happens with color Doppler. You could see again the movement. Of course, in the previous pictures you could see the movement even without color Doppler, but with color Doppler you have an added advantage of appreciating the movements which you miss out on 2D ultrasound, grayscale ultrasound. Now, acoustic streaming velocity, it increases with the increasing frequency and power and decreasing transmit aperture size. What does it mean? It means that whenever you are using color Doppler, in order to see the acoustic streaming better, keep a high frequency, keep a high power. Sometimes power Doppler can help you, and keep the aperture size small. Here you can see the width is more. So in case the width is reduced, you can appreciate this movement better. And in many cases when the movement is not seen, you can see the movement. So whenever you are scanning, you want to look for acoustic streaming. Sometimes by chance when you are doing the scan, you see without trying much. That is very good. In case there is a doubt between endometriotic cyst and other diagnoses like cystadenoma, then try looking for the acoustic streaming. What you can do, you can use color Doppler, and when you are using color Doppler, remember, keep the frequency high, keep the width of the beam narrow, and see that the power is at maximum, the energy is at maximum. So that's all.